Hi, my name is Dr. Joo-Hyung Lee. I'm a rheumatologist here at St. Joseph's Hospital. I've been in practice here since 2002, and I specialize in the care of patients in the field of rheumatology. Rheumatologists are a subspecialty within the field of internal medicine, and we deal with patients with various musculoskeletal complaints, including osteoarthritis, autoimmune disorders such as lupus, rheumatoid arthritis, osteoporosis, Sjogren's syndrome, inflammatory muscle disorders such as polymyositis and dermatomyositis, and patients also who experience chronic musculoskeletal pains from fibromyalgia. The first question we get is, why do you need to see a rheumatologist, and what treatment options are available that are specialized within our field? As a rheumatologist, we can perform a special physical examination along with incorporating laboratory testing, x-rays, and MRI studies to confirm or to diagnose patients with various musculoskeletal disorders. In conjunction with patients who see an orthopedic physician, we can offer oral medications to alleviate pain in patients who are either not surgical candidates or unable to have orthopedic care because of various underlying medical conditions. Medications include the use of anti-inflammatory medications for patients who suffer from osteoarthritis, along with various different types of pain medications or analgesic medications, including Cymbalta, Lyrica, tramadol, along with pain medications. As well, a rheumatologist specializes in patients with various connective tissue disorders. These are autoimmune disorders that affect patients ranging from teenagers to elderly patients. This can include rheumatoid arthritis, lupus, Sjogren's syndrome, and with the advent of new medications, it has revolutionized our field as well as improved the quality of patients' lives. In patients with rheumatoid arthritis, in the last 12 years, you have seen a tremendous amount of new medications that are available for patients. Prior to that, oral medications, including methotrexate, were used, and they had limited scope of improvement in patients' qualities of lives. With the use of subcutaneous and intravenous medications, this has revolutionized our care. Enbrel, for instance, is a subcutaneous medication that can be administered at home. It's important to see a rheumatologist to be started on these types of medications because they need to be monitored, and the appropriate medication needs to be given to each individual patient. Because of so many different medications that are currently available, it's important that you see a rheumatologist and have a long discussion with him as to what appropriate medication should be administered. In our office, we offer both subcutaneous, oral, as well as IV medications. For instance, IV Remicade is a newer treatment option. It is administered for about an hour to 2 hours every 8 weeks. Other newer medications include IV Orencia, which also now is available as subcutaneous Orencia. Subcutaneous medications are easier to use. They can be administered at home, and those are given by instruction by nurses and staff. In patients with lupus, treatment has not changed in more than 20 years. Until the introduction of IV Benlysta, a new medication for the treatment of lupus, it has altered many patients' lives. It is administered in our office once a month, about an hour per infusion. It has helped many patients with diffuse rashes, fatigue, as well as inflammatory arthritic complaints. Subcutaneous medications also are offered for patients with osteoporosis. We work in conjunction with our orthopedic physicians here, patients, for instance, who have suffered vertebral-related fractures. Patients who have suffered a fracture should be on treatment to improve the quality of bone and also to prevent further fractures. Medications such as Prolia are used and are injected daily for 2 years to prevent further vertebral-related fractures. Newer IV medications such as IV Reclass are also offered in lieu of oral bisphosphonate treatments such as Fosamax, Boniva, and Actonel. If you have any further questions, feel free to call St. Joseph Hospital.